Welcome, everyone. My name is Kirsten Pilati, the very proud CEO of Breast Cancer Network Australia. Well, tonight there is so many of you, so clearly this is a topic that many of you have questions for, which is let's cut through all the hype and why exercise webcast. Before we begin, I do want to acknowledge the traditional owners on the land on which we all around this beautiful country live. We know that our First Peoples have much worse outcomes than those of non-Indigenous across Australia. So we must continue to do more. It is great joy that we have so many of our First Peoples connected into our network. So for any of you online tonight, I welcome you and I thank you for looking after our country for so many years and providing us with such a beautiful place to live. So tonight we have plenty to get through. We will hear firstly from a couple of our consumers who will talk about their own personal experience with breast cancer. And I'm so thrilled that tonight we will be covering both the early breast cancer and metastatic breast cancer, because we know far too often those living with metastatic breast cancer are left out of important exercise programs that are available across the country. We will learn about the role exercise can play in pre, during, and for those of you with early breast cancer post-treatment. Some, I think, important, simple, free at-home strategies for all of us to do. And the session will also touch on some resources to seek support and assistance in making sure that we are all doing just a little bit more exercise tomorrow than we were today. So just a bit of housekeeping. We would love you to connect with each other through the discussion form, but also send through any questions. So you can see those on your screen now. So please interact with us, ask any questions. So let's get underway. First of all, I want to welcome Andrea Smith, who's a consumer representative. She has been living with metastatic breast cancer for 8 years and was diagnosed with de novo metastatic cancer. So that's where there was no early breast cancer diagnosis in 2016. There is so much more to Andrea, but I want to hear as quickly as we can from Andrea. But just to say that Andrea gives so much to our network through our consumer advisory group and through our metastatic lived experience group. So Andrea, welcome, and I'm going to hand straight over to you.
Thanks, KP, for that lovely introduction. And yeah, I'm delighted to be here to speak about my experiences as someone with metastatic breast cancer with exercise. As you said, I was diagnosed just over 8 years ago. No early breast cancer diagnosis. I was diagnosed with tumors in my bones and my liver, which obviously is potentially problematic from the point of view of exercising. So before my diagnosis, I would say I was relatively active. I did a lot of yoga. I swam probably once a week. I cycled to work at least 3 or 4 times a week, and I bushwalked. So I did quite a lot, but probably not at a really high level. And to me, exercise was really important. It was sociable. It was a form of active transport. So it was a real concern to me when I was diagnosed with bone metastases to think about what is the impact going to be on what I'm doing now and in the future. So initially, with my diagnosis, I obviously quickly started treatment, which was targeted therapy and chemotherapy. And my relationship with exercise was pretty fraught. I had pain due to the tumors in my bones, in my spine and my hips and my ribs. And it caused pain when I was cycling, and even it started causing pain when I was walking. So as I said, my greatest concern was, was I going to continue to lose functionality, and what would I be able to do in the future? At one point I felt glad that I felt I'd achieved something when I was walking around the block, where my breast care nurse told me the best thing to do for my constipation was to get up and actually do something. So for me, the challenges that I've faced have been multifaceted in that people with metastatic breast cancer will always be on treatment because, the intention is not to cure us, it's to control our tumors for as long as possible, hopefully for many years. So I've experienced, a range of different physical limitations and also, I think, psychological limitations. I've had several surgeries over the last 8.5 years, and I've been on multiple different types of treatment. Although fundamentally I'm still getting intravenous treatment every 3 weeks. So as a result of those, I've experienced different challenges and limitations over time. Initially, the big problem for me was to understand how I could exercise with bone metastases. And I sought professional advice. So I went to speak to health professionals, which included physios and exercise physiologists and a yoga teacher. Several of them who were at a specific cancer center. And unfortunately, the overriding message I got was to be careful, to be cautious. I was told at one stage, don't run, don't carry anything more than 10 kilograms, adapt your yoga poses. For me, running wasn't a problem because I hate running, so that wasn't a big concern. But adapting my yoga poses was a real problem. I no longer enjoyed yoga because it was so limited as to what I could do. So I had to look around for something else, and I switched to dragon boating. And that was because it's an exercise designed for people with breast cancer. And I started very slowly after about 6 months into my treatment, mainly as a social paddler. But in 2018, I attended a BCNA information forum in Melbourne, where there was an exercise researcher from Perth who spoke extensively about the benefits of exercise to people with cancer. And that inspired me to sort of think I can do more. So I became involved a lot more competitively. And I was, in my breast cancer team, there were women who had represented New South Wales and Australia. So they very much encouraged me to, set goals. And, in the last 3 years, I've represented New South Wales twice in the dragon boating team, which for me has been incredibly satisfying, but has meant I've had to work very closely with my medical oncologist for advice about how to manage some of my limitations around, I've experienced stress fractures in my ribs, which sounds alarming, but wasn't actually that painful. But my medical oncologist was very good at supporting me, directing me to exercise physiologists and physios who could help me manage and improve my fitness. So I think, for me, I think there have been enormous benefits, and I think exercise is something that can seem alarming and difficult to integrate, especially with a metastatic diagnosis. But I think, hopefully, some of the examples I've given are ways to show how it's possible to do it.
Thank you so much, Andrea. And there are already loads of questions coming through, and I think you are not alone in not having so many questions around living with metastatic disease and how you can look after yourself from an exercise perspective, but also we know that there is lots of other unmet needs for those living with metastatic disease. So if you do have other questions for that, please make sure you reach out to BCNA online, and there is a whole lot of resources available for people. So our next consumer, another underachiever in our network. We're full of these incredible women and men who've been diagnosed with breast cancer, who really want to give back and make sure that that they are representing each and every one of the 200,000 people in our network. And so Dr. Naama Carlin is one of those. And Naama is a sociologist and academic living in an unceded Bidjigal land, and her partner Bub and Cat, which we always like to know about the animals that bring us joy. Naama was diagnosed with triple negative breast cancer at 29 weeks pregnant and received her first dose of chemotherapy at 30 weeks pregnant. So Naama, I know that you have had to do lots of self-advocacy, but you are also a great advocate for BCNA. So tell us a bit about your experience with exercise.
Thanks, KP, and I'm really honored to be here and to speak to all of the wonderful consumer reps. Wonderful attendees. I remember when I was first diagnosed joining BCNA webinars such as this, so I know the value of it. I was diagnosed with triple negative breast cancer when I was 29 weeks pregnant. So the issues around exercise intersected with exercise around pregnancy. I was relatively active before I got pregnant and then before my cancer diagnosis. So I mostly ran, much like Andrea. I hate running, and yet I persist and continue to run despite really not liking it. It's a free form of exercise, and I'm really committed to taking advantage of any form of exercise that is free and accessible at any fitness level. So that's kind of what I do. And when I was pregnant, I did lots of yoga. It was during COVID, so it was all online via Zoom. And it was wonderful to do yoga 3 times a week. It felt very grounding in my pregnancy and then in my cancer diagnosis. And I really think that it helped me so much to get through the chemotherapy. So I started having chemo at 30 weeks. I had AC, a couple of rounds, and then a break for my C-section. And then I continued with chemotherapy. So I was also recovering from a major surgery at the same time that I was going through treatment initially. For me, getting back to running was such a key priority after having my C-section, because I wanted to stay healthy and fit for when I underwent chemotherapy. I knew the importance of having a healthy heart, and of my breast care nurses and the chemotherapy nurses. But it wasn't breast care nurses, and it was chemotherapy nurses who reminded me to always go for a walk the day after I had treatment and how important it is. So exercise when you're undergoing treatment can be anything from a 20-minute walk and occasionally even a run or any other form of fitness. So while I was a mid-level exerciser before I was diagnosed, I really continued with yoga and walking. And after my pregnancy, I went back into running within 5 or 6 weeks. I also joined an outdoor training session at that time for all fitness levels, mostly because there was an option to leave bub with a nanny. So I needed to kind of get out of the house with a newborn. And I did this twice a week. It was like a boot camp style. And I started doing push-ups and doing weights and doing cardio and all these different forms of training that had such a positive impact on my body. So during treatment, when I was undergoing carbotaxol, I became anemic and my platelets were just knocked back. I remember walking into treatment one day and the nurse going, "Oh, you must be exhausted. You are so low in iron. You need to get a blood transfusion." And I was like, "I just went running this morning. I don't know what you're talking about. I had training this morning for an hour. I was exercising." So I didn't feel fatigued. I didn't feel lacking in energy. It helped keep me positive as well. And importantly, it helped me recover from my mastectomy. So I had a mastectomy with node clearance on my right arm. That means that I don't have my right breast anymore, and I don't have my lymph nodes in my right arm. And that was really difficult to recover from. And so adhering to physiotherapy exercises, and even something as small as learning how to lift your arm again, that in itself was exercise for me for a lengthy period of time. And then I continued into stretching, physio, yoga, and continued on to my routine of lifting weights. My right arm is still a bit weaker than my left arm, but I still persist and I carry the same weight and do the same weights in both arms. And it's really important to me as well to continue pushing myself in this way. And it's just to continue to persist. And I'm really proud to say that a few months ago, last year, I guess, I did the 10K at the Sydney Marathon on a whim. I got a ticket for the next day and I pushed through and did I'm so proud that I got just ran. And it was wonderful. And I'm hoping to train for for a half marathon coming up. And these are the small things that you can do to help, or that I did to help keep my my mind clear and my body healthy, so that I can tolerate the chemotherapy and deal with a baby.
You are very inspirational, Naama, and that is clearly coming through already. And looks like there's plenty of dragon boaters online tonight, and plenty of people who love yoga too. So thank you very much, and please send through any questions that you have for both Andrea and Naama, because we will come back and have a Q&A session after our next guest speaker tonight, who is Lauren Whiting, who is an oncology physiotherapist with a special interest in the use of exercise as an anti-cancer treatment. Lauren is one of the founders and CEO of Lift Cancer Care Services based in Adelaide. I also know, Lauren, that you have won many awards, including in 2021, the South Australian All-Rounder Award and recognition in the 2022 South Australian 40 and under emerging leaders in business. So how lucky are we to have all of these incredible women? So Lauren, we would love you to take us through now some of the very practical tips to help people navigate both in the early breast cancer setting and the metastatic setting. And thank you so much and welcome.
Thanks, KP. It's a pleasure to be here. And thank you, Naama and Andrea, for your insights and for beautifully framing what we are going to do together in this webinar. We are here to cut through the hype and talk about why exercise is so important for people with breast cancer. Next slide, please. As KP mentioned, my name is Lauren Whiting. I'm an APA oncology physio, also the CEO and founder of Lift Cancer Care Services in Adelaide. Next slide. And Lift is a business that we started about 7 years ago, and we brought together a lot of allied health services that people with cancer commonly need, but we have got a very big focus on exercise. Next slide, please. So not that long ago, if you got diagnosed with cancer, you probably wouldn't have been thinking about exercise as something that's going to be an important part of your treatment. Your focus probably would have been on things like chemotherapy, and you would have been told to go home and rest and, quieten things down a little bit. But in recent years, there's been a real shift in our understanding of the role of exercise for people with cancer. And there is a really exciting growing body of evidence to support the many benefits that this wonderful modality represents. Next slide, please. And hopefully by the end of tonight, you are going to be a little bit more knowledgeable and inspired to make sure that this is part of, one of the tools in your kit as far as your cancer treatment goes. So, exercise has long been accepted as a really important part of a healthy lifestyle. The benefits are well documented. None of us have any concerns with any of this. Next slide, please. But what we've realised recently is that there are additional benefits that people with breast cancer have access to, and they involve, managing side effects as well as improving overall survival and reducing the cancer rate of recurrence. Next slide, please. So exercise is something that does need to be incorporated in the overall care for people with breast cancer. And more this is being seen as a vital part of treatment and survivorship. Next slide, please. Back in 2018, the Clinical Oncology Society of Australia released a position statement, and this is the first position statement on exercise in cancer care. Next slide, please. And this position statement highlighted what the recommended dosage of exercise should be every week for someone with cancer. You can see it up here, 150 minutes of moderate intensity aerobic exercise. So moderate intensity aerobic exercise is when you are, quite puffy, but if I were doing that now, I'd still be able to talk to you, but you'd be able to hear my breathing. It would be a little bit laboured. Or 75 minutes of a vigorous intensity exercise. And vigorous intensity, if I was doing vigorous intensity right now, you wouldn't hear any words coming out of my mouth because I would be focusing all my energy on my heart and lung and my breathing. And in addition to this, the guidelines also state that we need to be aiming for a minimum of 2 strength sessions per week. Next slide, please. The practice recommendations highlighted 3 really important points. The first one was that exercise should commence as soon as possible after a diagnosis. The second one was that exercise should be maintained regardless of the stage or the type or the treatment that the person is undergoing. And the third one was that exercise should be tailored to support the specific needs of the person with cancer. Next slide, please. So we're now going to just have a look at, I've picked out some of the common treatments at a very high level that someone with breast cancer would undergo, and we'll have a look at the benefits that exercise represents for each of these. Next slide. So surgery is a common one, and whether this is a lumpectomy or, full mastectomy, or whether it is, reconstructive surgery, exercise has a really important role in lots of things. Reducing pain is a big one. Naama mentioned before, restoring shoulder movement. So it's really important that exercise is started soon after surgery and continues for a period of time, so that, movement through the shoulder, but also the neck and the upper back is restored. Because what we're aiming for is that you can get full function of your arm back, and that you are able to do what you need to do on that side of your body. Exercise is really important as well, because we know it's really good as a boost for our circulation and promotes healing. And it's also really, really critical in reducing lymphedema risk. Again, Naama mentioned that, she had some lymph nodes taken out as part of her surgery. And anyone who does have lymph nodes removed, or even a sentinel node biopsy, we know that puts you at a higher risk of lymphedema. So we want to get those muscles pumping and encourage that lovely lymphatic flow. Next slide, please. Chemotherapy, obviously a very common treatment in people with breast cancer. Exercise plays a critical role in managing fatigue, and we're going to talk a bit about that further on. But it's also very important in managing some of the long-term cardiac issues that can result following certain drugs in chemotherapy. And again, we've heard it already from our consumers. We know that exercise, if you're able to engage with it, it actually helps with your tolerance of treatment and your adherence to the chemotherapy plan that your medical oncology team has for you. Next slide, please. For anyone who undergoes radiotherapy, there are a couple of ways that exercise is important. So leading up to radiotherapy, and particularly if you've had surgery, exercise can be something that you need to engage in so that you can actually get in your treatment position. You can see on the slide here, that arm above the head is a common treatment position for breast cancer. And if you haven't exercised after your surgery, sometimes, and we've seen this at LIFT, patients actually, there's a delay in their radiotherapy because they actually need to get some exercise program in place so that they can actually get the position and the posture that the radiation therapist needs them to have. And then after radiotherapy, exercise is important because, the scar tissue that is formed as a result of radiotherapy means that, you lose some of that lovely elasticity and stretchiness in your skin. And so we want to make sure that you can maintain really good function in your shoulder, but your whole upper quadrant, and exercise is critical for that. In addition, the fatigue, healing, lymphedema risk and heart health that overlapped with the others there. Next slide, please. Hormone therapy, again, a really common treatment for people with breast cancer. And obviously this is one that goes on for a while, right? So this is over several years for most people. And exercise is very, very important if you're on hormone therapy, because we want to make sure that, we are maintaining good bone health. We are, maintaining a healthy body weight, but also exercise can help with some of those other pesky things like, the fluctuations in mood, again, the fatigue, and, what we hear commonly around the joint pain and stiffness that people experience. Next slide, please. So we're just going to unpack a few of these side effects now in a little bit more detail. Next slide. Cancer-related fatigue. So I've mentioned this before, and absolutely this is one of the most commonly reported and widely experienced side effects of treatment. And it's something that I talk to my patients about because, I haven't experienced this myself. I've certainly felt tired, but tiredness is not what cancer-related fatigue is. It's something that can be very debilitating. It can be very long-lasting as well. And, it's not something that we can manage with, pharmaceutical. So, for example, nausea is a common side effect that, the drug companies have been able to, help counteract with different medications. But there is no medication that we can give people to help with cancer-related fatigue. But what we know now and what the literature shows us is that exercise is actually the best way to manage cancer-related fatigue. And that can be quite challenging to get your head around because, it does seem quite counterintuitive that you would be engaging in a physical activity when you feel, so fatigued. Next slide, please. Body composition changes as well. These ones can be overlooked, and we touched on it with the hormone treatment. We know that there are going to be changes in things like your bone mineral density, so how strong your bones are and how dense they are. We can't always see that though, and but we know it's happening. Also, we can't see the proportion of, lean muscle mass compared to body fat. We can sometimes sort of see that there is a bit of extra fat, but we can't really see it all the time. But we know it's happening, and exercise plays a critical role in making sure that we're maintaining that, nice bone mineral density, and we're optimizing the strength of our bones, as well as increasing our lean muscle mass, and also just keeping body fat at an optimal level. Next slide, please. We also know that people who have had breast cancer treatment are at an increased risk of developing, cardiac issues further down the track, more so compared to the general population. And again, when you're undergoing your treatments, or you've just been diagnosed and you're starting on the surgery and chemotherapy and radiotherapy, so forth, you're not necessarily thinking about, longer term, side effects. But we know that it's that is something that comes up, and in order to maximize your cardiac health, we always look at lifestyle factors, and lifestyle factors mean things like weight management, or keeping with that healthy weight range, reducing alcohol or cutting it out, stopping smoking if you're a smoker, but the big one is exercise. So again, another really compelling reason that exercise needs to be integrated as part of your treatment. Next slide, please. Peripheral neuropathy, again, another side effect which can be quite debilitating. So some of the chemotherapy drugs will cause, it's a tingling or pain, in the hands, or it can be in the feet. And for people who do suffer from peripheral neuropathy, it often doesn't resolve, and it can significantly impact function. And what we want to do is we want to make sure that if you've got peripheral neuropathy, you're still moving, you're still strong, you're doing all the things that you want to be doing each day. And balance for people who have peripheral neuropathy in their feet can be quite challenged, and we often see that reduce. And we want to make sure that balance is maintained. We can do that through exercise, both through specific balance exercises, but also through exercises that help to keep the lower limbs strong. So targeting those really big muscle groups, like the calf muscles and thighs and the glutes and the hips, because we want to make sure that, your balance is optimized, and we want to prevent, things that are quite preventable, like falls, which can then lead to other things like hip fractures. Next slide, thanks. And psychological distress, this is a big one. And, you look at the literature and it is very, very compelling. Exercise is very widely accepted and encouraged as a critical tool for managing psychological distress. And I suppose this is a broad umbrella term. Psychological distress can, vary significantly. It can be that sort of very common and very normal adjustment that that people undergo when they first get a diagnosis. But it can also be, other things like anxiety and depression and other mood disorders. And exercise is wonderful for helping to manage our mental health, but also depending on how you choose to engage in exercise, there can be other psychological benefits as well, such as, we've heard about dragon boating tonight, getting involved with, a group, or, exercising with another person, and sort of weaving that social interaction through the exercise as well for another layer of added benefit from a psychological and wellbeing perspective. Next slide, thanks. Minimising lymphedema risk. So for anyone who has had surgery that has removed lymph nodes, or for people who have had radiotherapy over the top of lymph nodes, we know, and it's a fact, that increases your risk of developing lymphedema. And that lymphedema is something that can can crop up early on in the piece, but, the risk stays there over a period of time. So even, 2 years, 5 years down the track, that risk still exists. But what the literature tells us is that if you are exercising, you are doing, you're doing a very important thing in keeping that risk sort of where it is and not letting it escalate any further. Next slide. And for people who do develop lymphedema, exercise is absolutely critical as one of the tools in the ongoing management of lymphedema. So, lymphedema is a chronic condition, unfortunately. So in addition to things like, compression garments and having massage, exercise and keeping a healthy weight are two lifestyle factors that are very, very important. And also very important for immune function, which is, another big benefit for people who do have lymphedema. Next slide, please. And so I suppose really everything that I've been talking about here as far as the side effects, they all do come under this, quality of life umbrella, and really what we are trying to do with exercise and in managing, a lot of these very common, side effects and the fallout, if you like, from a cancer diagnosis and subsequent treatment is we're wanting to maximise your quality of life. It's one thing to have, the cancer treatment sort of happening, but, who are you at the end of that for people who do actually come to the end of a treatment, or for people who don't. We want to make sure that we are maximising your enjoyment of life, your physical health, your emotional health, and doing everything within our power to make sure that you can still, participate in all of the daily activities that you enjoy. Spending time with friends, family, working if you want to, and that's what this all really comes down to, is maximising quality of life. Next slide, please. Unfortunately, the other thing that the evidence tells us and the literature tells us is that most people who have cancer don't actually meet the recommendation guidelines. Next slide. 70% of people with cancer, and this is not just breast cancer, sorry, this is broadly, but 70% of people with cancer don't meet the aerobic guidelines. That compares with about 55% of the non-cancer population. Next slide. And a whopping 90% don't meet the strength guidelines, and that compares with about 65% in the non-cancer population. Next slide. So we need to do better. And why is it that we can't connect with exercise? Well, there are a lot of barriers. There are a lot of barriers for the non-cancer population, but when you have a cancer diagnosis, there are some very, very valid and significant barriers. The psychological barriers can't be understated, and in my clinical practice, this is what I hear the most. There's a lot of fear. You don't want to do the wrong thing, and you don't want to be putting your outcomes at risk. And if you don't know what to do, it can be very scary when someone sort of suggests to you that you should be exercising. Motivation is the other one. I mean, we all know that it can be very tricky to get ourselves motivated to exercise. Again, very valid. Beliefs, our own belief systems and the beliefs of others. Like I mentioned before, a lot of people don't think cancer and exercise go together. So, if you've got friends and family around you who are of that sort of thinking, and you're talking about exercising or wanting to exercise, they might be telling you not to, or not encouraging and not supporting you to do that. And that's something that I hear a lot as well. And then, the cruel irony, a lot of the treatment side effects that we know benefit from exercise are also the things that are barriers. So, the fatigue we talked about, the peripheral neuropathy, bone mets, pain, continence issues. There are so many side effects that you might be experiencing, which can actually be helped by exercise, but they just add that extra little barrier in there as far as actually connecting to the exercise. And then there's access to services, and Andrea mentioned up front, she was encouraged to go and talk to some healthcare professionals, some exercise professionals, but exercise professionals are still not all fully equipped with the knowledge and experience to help with this. And then there's geographical issues if you're living rurally or remotely, and of course cost as well. Next slide, please. So how do we overcome some of these psychological barriers? I think the first thing, and I often talk to people with breast cancer around this, is just sort of really challenging your own beliefs and examining them and working out what you think. Most of the people, by the time they'd come to someone like myself, they understand that exercise is important, but they will often be thinking about, what they should be doing, and what they were like before they got diagnosed with cancer. And, a conversation that I have really, really regularly is that, you can't compare yourself to how you were, before you got diagnosed. It's not useful. They're completely different parameters. And, what we're thinking about once, you have been diagnosed and you have breast cancer, is doing what you can, now, with what's going on. And we know that's not the same as what was going on for you before you got diagnosed. I think the most important and the most effective way of overcoming psychological barriers is really reframing how you see exercise. And compliance to exercise, in my experience, is significantly improved when that dot is connected and you're like, right, exercise is actually part of my treatment. Exercise is something that is going to help me. So in the same way that you would, accept to do chemotherapy or radiotherapy or take the hormones or the hormone therapy drugs or have surgery, things that we know are not necessarily going to be pleasant, but, the choice to do them is still made because we know that the outcomes are going to be there. And if exercise can be viewed in the same way, it's not always pleasant to do. Motivation can sometimes be lacking. We can't just swallow a pill, but if you can view it and reframe it as treatment, exercise is medicine, is what we talk all about at Lift all the time. If you can reframe it, that is very important. And rallying your family and friends, getting their support. We all know that when someone gets a cancer diagnosis, family and friends, they really want to help, and they'll come and they'll clean the house, they'll look after the kids, and the freezer will be full of lasagna, which is all excellent. But maybe you could consider having a conversation with, a couple of family members or friends and trying to enlist them to support you and help you, and do some of the thinking for you about planning your exercise, or doing some of the legwork about looking at where you can get some support for your exercise. And then I think as well, talking to your team. So when you do have other things happening, or, you've got metastatic cancer, that can be scary. And having that conversation with your treating specialists to give you the confidence that it is okay to exercise. And if there's anything they're particularly concerned about, asking them about that and getting some advice about how that can be managed can be very, very useful in overcoming some of those barriers. Next slide, please. So what type of exercise is safe? Let's have a think about some of those treatment side effects and some of the guidelines. Next slide, please. So in general, I've just mentioned, talking to your healthcare team, mention that you want to do exercise. If there's anything that is of particular concern, they will talk to you about that. But starting slowly is critical. So you want to start slowly and progress your exercise gradually. The reason that we say this is that exercise is something that, is not, we don't want to just do it for a short amount of time. This needs to be lifelong. You need to continue to exercise. And it's not uncommon, and I've seen this lots of times before, you get that burst of motivation or energy and you think, yes, I'm going to do this. And you don't start slowly, you go quite hard, but then you crash. And we really want to avoid, this crash and burn cycle. So you want to start slowly because exercise needs to be sustainable over a longer period of time. It's really important as well that you're listening to your body. We know that you're not going to feel the same, at the start of the week compared to the end of the week necessarily, particularly if you're on treatment. The way that you feel and the way that your body is can vary, a lot. So you need to listen to your body, and you need to adapt that sort of flexible approach to what you expect of yourself from an exercise point of view, and adjust as you need to. So that might be adjusting within the week or a couple of weeks. And, if you've just had treatment, you might find that, you can only walk a short distance, and that's fine. But, a week later, you might be able to walk twice as far, and that's fantastic. But also in the context of people who have metastatic breast cancer, with treatment progression, we know that there needs to be, that adjustment over a period of time. And, my strong message to everyone is that you can always keep exercising. We just sometimes need to modify things. So if your functional ability changes or side effects, change, or you start experiencing extra side effects in that metastatic space, that doesn't mean you need to stop exercising. It just means that it needs to be modified. Hydration and fueling your body with food is really important. And if you're not sure what that means or what that looks like for you, seeking some advice from a dietitian is a good idea. But also just being kind to yourself. Don't expect too much. Like I said, exercise needs to be sustainable. Give yourself a pat on the back. There's a lot going on and there are a lot of barriers. So once you get started, be proud of yourself. Next one, please. There are some things, though, if you're exercising and if you experience these symptoms, you do need to stop your exercise and go and seek a medical review. So things like chest pain, significant shortness of breath, significant joint, muscle pain, joint pain, or dizziness or faintness. So this is your body clearly telling you to stop, and it is not recommended that you're exercising if you're experiencing any of those. Next slide, please. Bone mets. So again, some general recommendations. All of this will depend, of course, on where your bony mets are. So this is of a general nature, but we're looking at low impact activities here. Things like walking, stationary bike, swimming. We've heard about the dragon boating, and wanting to avoid those really high impact, forceful sort of exercises, jumping and so forth. Strength training for people with bony mets should be of a light to moderate weight. So we're not wanting to really, really load the bones up. We want to make sure that we are incorporating strength training because we want to keep really good muscle strength around the bones. That is critical to help support them. But we don't want to go to that, more vigorous strength level. And again, starting slowly, progressing gradually, but really, really importantly, monitoring for changes. So in the locations where you've got your bone mets, you're wanting to monitor, around those. If you've got spinal mets and you've been doing exercise and, you're finding that it's uncomfortable, that might be something that you need to, need to seek some support with. Exercise should be comfortable. Next one, please. Lymphedema, a lot of myths around this. So if you have lymphedema, it is safe to be using your arm. And in fact, we want you to be using it. Strength-based exercises are really, really important. But you shouldn't be finding yourself, out of control with your weights. So you start at a low level. It is very safe to progress the weights that you're using, but this needs to be done slowly. And, a general rule of thumb is that, you should be in control of the weight as opposed to the weight controlling you. It's also important that if you have compression garments that you're wearing those when you're doing your exercise to help with that lymphatic return. And also, the bra that you're wearing. So a wide strap bra is always a good idea with exercise. And if you're noticing that your lymphedema symptoms are changing in and around exercise, again, that would be, a time to go back to your lymphedema therapist and get that professional input. Next slide, please. Peripheral neuropathy. So again, in this with this side effect, we're looking at more of those low impact exercises, things like walking and swimming, bike. If it's in your feet, chair-based exercises can sometimes be a really, really good starting point if your balance isn't quite there. And including balance exercises is critical for people who have peripheral neuropathy in the feet. And I mentioned that before. Wearing supportive shoes, we want to make sure that you've got well-fitted shoes so that you're not tripping over yourself because sensation and knowing where your feet are in space can be impaired. And if you've got peripheral neuropathy in your hands, just considering the types of exercises that you're doing. So you might be, avoiding sort of the gripping type exercises, but there are ways around that. There are devices that can help to Velcro, weights onto your arms, or you can be using TheraBands. Next slide, please. And fatigue, I've been mentioning this a bit, but it is really, really, like I said, very common and very debilitating, and exercise just feels counterintuitive, but start where you can and start small. Just give yourself a goal of just doing, a very small amount of exercise, because we find generally that once you start, that helps to get you to keep going. But consider for yourself, or just reflect, is there a pattern for me as far as, when is my fatigue worse? Do I find that I've got worse fatigue in the morning, or is it worse in the afternoon, or after I've eaten? What is it for you? Work out when it's at its worst. Don't schedule exercise for that time. Schedule exercise for the times that your fatigue is a little bit less. And seek support. So again, talk to your friends and your family, tell them what you've scheduled, or get them to help you do that, so that when you're feeling, that deep fatigue, you've got that extra bit of help to connect you with the exercise. Again, if you're not eating properly or eating enough, and if you're not drinking water, that's only going to compound the fatigue symptoms. So don't forget that. And scheduling time to recharge is really important. And this is something, again, that we talk to patients a lot about. We schedule the exercise time, but also schedule some downtime. So not sleeping or, lying in the bed necessarily, but, just some low energy, times. So, low cognitive load, low physical load, things like, listening to some music or maybe reading a book, watching some telly, so just a bit of a recharge. Like we plug our phones in, we also need to plug ourselves in and schedule that into the day as well. Next slide, please. And I suppose, with all of these things, and again, very common, and, the people that I would see in practice and the people we see at Lift, they might sort of hear the type of advice that we've just gone through, but there are lots and lots of, things that still feel very hard to them. And that's where exercise physiologists and physiotherapists can come into play. So, this is our bread and butter. We understand how to deliver exercise safely and in line with, the treatment guidelines. And, our skill is in assessing and managing, the person in front of us. So, I could have a room full of, 10, 20, 100 people with breast cancer. And on paper, their diagnosis and treatment looks very similar, but no two of them would be the same. So next slide, please. So if you're struggling, my recommendation would be to seek out, the support of an exercise physiologist or a physio who's got oncology experience, and that is critical, because what they will do is they will prescribe exercise for you that considers a range of things like your diagnosis, your treatment, the side effects that you're experiencing, but also things like your past medical history, what happened before you got cancer, because they'll probably still be relevant health issues, and, your musculoskeletal history, and also what your current functional status is, and, what your exercise tolerance and ability is. Next slide, please. I just wanted to mention at this point on the back of that, the literature does clearly sort of describe the fact that the benefit for exercise, is greater if you can connect yourself with supervised prescribed exercise. That's not to say that if you don't do this, there are no benefits. Absolutely not. But if you are able to connect with someone who can help you to prescribe a program and supervise can mean just checking in every 6 or 8 weeks. It doesn't mean they need to be sitting there watching you do it. But certainly that would be something I would encourage you to think about. Next slide, please. And, there are lots of things that you can do at home by yourselves. You don't need lots of equipment. I've just listed a couple of things here that would make up, part of a very basic, upper limb series that you could do at home. Things like your shoulder circles, there are ranges of neck stretches that you can do. Sunbaker is a lovely stretch that helps to open up the chest. You can grab your, I've got my beans next to me here, or your water bottle, and you can do bicep curls, rows, triceps, punching the air, so sitting there and getting your heart rate up by just doing some punching with or without weights in your hands can be really useful. And also, some lovely breathing exercises that help to encourage, optimal function of that whole upper body. And these sorts of things can be done, in sitting, in standing, and yeah, very simple and accessible to connect with, even if you can't get yourself to an exercise professional. Next slide, please. And, this is something that we sort of say a lot, and you've probably heard this before if you've looked into exercise at all, but, if exercise were a pharmaceutical medication, if we could bottle all of this and put it in a pill, it would absolutely far and away be the most prescribed medication worldwide for the benefits that it represents. And, I hope that in this presentation tonight, and thank you for being here, I hope that, you have been inspired to think about exercise as a medicine, as a treatment, and it's something that you need to be engaging with, not just now, but lifelong. Next slide, please. There are lots of resources and supports available. The BCNA helpline is one we've put up there, and the wonderful team, Monday to Friday, 9 to 5, you can give them a call and they can help to connect you with resources and supports in your area. There will also be a home exercise resource emailed out to everyone who's registered for this webinar, and some other information in that around where you can seek further support. Next slide, please. So that's really all from me. Lots of medicines are excellent, but there you go. I think exercise is the best medicine. Again, thank you for attending, and thank you for this opportunity to talk about what I think is a really exciting treatment modality for anyone with breast cancer. Thank you.
Thank you so much, Lauren. I can tell you that everyone needs to sit tight because there is a lot of questions. I'm going to try and fly through them. And I think, Andrea, one of the ones that keeps coming up is, well, how do I get access to a program in my local area? And, you know, as Lauren said, you can call our helpline and we can connect you. But one thing I know you and I have often spoken about is how hospitals actually provide a lot of services that people just don't know about. What advice would you give to someone about making sure they knew what were all the opportunities for rehab programs or exercise programs within the hospital system?
I think you're right, KP. I think the first place is to actually start asking questions of your treating team as to what's available at your hospital or in the community. I think breast care nurses are a great resource. And I was actually very surprised at how things have changed in the 8 years since I've had treatment in terms of what's available at my hospital. And then I think looking to like the cancer councils, they run programs like Enrich, which is a diet and exercise program, and the YMCA that run a fitness program. I think, you know, try and explore your options and find one that works with you. And, you know, as I said, you know, dragon boating is available in many places around Australia, and it's designed specifically if you go through a breast cancer dragon boat club for people with breast cancer. And it's a relatively low cost option. It's only a few $100s a year, and for me, it gets me 3 training sessions a week, which I think is incredible value for money. So I think a lot of it is about asking the questions of, you know, because I think quite often people don't tell you, the GPs don't tell you, your medical oncologist don't tell you. So I think you have to prioritize and say, exercise is important to me. I've heard this. Who can you put me in contact with?
It's so true. And of course, you can also access the program through your GP to at least get some subsidies for exercise physiologists as well. Naama, there's a lot of discussion in the questions about staying motivated. Now, you seem to be at the extreme of motivation, I have to say. Even for someone who hasn't experienced breast cancer, you're very inspirational around how much exercise you're doing. But what things do you do to help stay motivated and to be able to keep doing the kind of exercise that is important to you?
It's funny that you say, because I don't feel motivated, and many days I just can't, like I'm too tired. But I do try and think of exercise as medicine. And I think for as someone who had a triple negative breast cancer diagnosis, and I'm sure there are many others here joining, you know, we don't get that additional level of treatment. You know, if we finished our round of, if we finished chemotherapy and radiotherapy and surgery and everything that we've done, there's no hormone treatment. And that can feel a bit discombobulating because you're out in the world and suddenly there's nothing. So I use exercise as medicine. It's basically saying, if I don't know, doing this is my equivalent to, you know, taking, you know, getting a transfusion, taking a pill. It's just kind of changing my mindset. Staying motivated, it is hard, but I also don't get too hard on yourself, because you can then get into a spiral. Oh, I haven't done this, I'm too lazy. You know, what's the point? Tomorrow's you wake up in the morning and it's a new day, you know, thank God it is. So that day is the start, you know, you can start that day and make the conditions for your success. I sound like like an inspo child on Insta, but it can be really tricky, and I acknowledge it. And, you know, I haven't exercised in a week because I had COVID and I was tired. But there's no need to feel bad about yourself if you haven't done it. Whatever you can do, that's what you can do. That's your best. And then you just keep going and keep improving. There's, you know, for runners, when you're training to do like a half marathon or anything like that, that speed, the distance that you're running that day, that's the furthest that you've run. So every week you run a little bit further. You know, you're not running the half marathon every single week. You're building up to something. So that's the mindset. Every time that you do exercise, that's the most exercise that you're going to do. And then the next week, you're going to do a little bit more. That's my way of thinking about it.
I feel like I want to get an SMS from you each week just to keep me motivated, but maybe that's another whole program we can think about doing for BCNA. Lauren, a couple of quick questions I'll ask you. One is around being on zoledronic acid, and does that change the way you should approach strength training?
Oh,
I'm happy if you want to refer people back to their oncologist to talk
yeah,
to.
I think I mean, these sorts of questions, again, like I said, even, if you look at a population of people with, similar diagnosis, there are lots of other things that are, going on that generally that sort of question I would, even as someone working with these patients, I would generally refer them back to their medical team to have that conversation. And because we, as physios and exercise physiologists, we do work with the medical specialists in order to negotiate with them as to, what they're comfortable with and what we recommend.
I'll stay with you. I actually love this around the kind of support bra, and when we transition, and I know this person's talking about they've received the My Care kit, so the Burley bra, which has the front and back fastening, which has all been developed for that 6-week period post surgery. They're just asking when's the right time to get back into a fully supportive sports bra that isn't going to cause any challenges around their surgery.
Again, that's going to vary significantly, and it's going to depend on how they recover from surgery. Commonly women will experience, breast edema as well. So there's lots of different sort of parameters that would guide that. But those bras are excellent, and some people will stay in them a little bit longer. And having a well fitted supportive bra is something that helps for lots of on lots of fronts. But again, something that's going to be individual, and hard to give a sort of a straight answer on that one.
Building up muscle strength and bone density, what should be their focus in terms of their exercise program?
So we want to be loading the bones. Focusing on big muscle groups is always a good idea, because that is going to help with building muscle mass and also bone density. Weight bearing exercise. And again, depending on, there are so many variables. If you had bony mets in the long bones, would give you different advice compared to if you didn't. But it's focusing on big muscle groups, but making sure that we are doing weight bearing exercise, and strength training is critical for anyone with breast cancer.
And I'm wondering this question, Andrea and Naama, if either of you have had that experience of bone pain as a result of treatment that has really restricted your ability to walk, and what might have been some of the things that you've done to move on from that or help to continue to motivate you. It seems like you might have an answer to this, Naama.
Well, I think that Andrea would have a good answer as well, based on your diagnosis. But for me, certainly there was a lot of bone pain during treatment, especially around. So again, it's a matter of taking it slow when you can. A lot of stretches, gentle stretches, and really vitally, like going for a walk, staying active in that sense really, really helps. So even doing those really small things that you think are not achieving enough, that was the key. But yes, and having a hot water bottle curled up with that bone pain was really, really serious.
Andrea, any tips?
Yes, I mean, so I think I've experienced, I suppose, 2 types of bone or joint pain. When I was put initially on letrozole, which is a aromatase inhibitor, which after 6 months caused a lot of joint pain, and I then was switched to tamoxifen. So that was a medical way of dealing with it. But with my metastases in my bone, I've been fortunate enough that over the 8 years, my bone mets are now well controlled and well healed. But I think for me, the message is that what I did at the beginning, 7 years ago, is very different from what I'm doing now and what I'm achieving and what I can do. initially it was about walking and engaging in very light yoga that was, for a long time very frustrating. But once my treatment kicked in, I could up the amount of exercise I did and increase that. So on the whole, I haven't had bone pain, apart from when I've created distress fractures in my ribs from probably over exercising a little bit. But that's been dealt with by not freaking out and saying you can't do this, but by going to a physiotherapist, an exercise physiologist, to work out how to increase my flexibility, how to improve my muscle, how to change my technique. So for me, I think it's always, as Lauren was saying, about start slow. You progress gradually and adjust depending on where you are post your diagnosis and at what stage you are in your treatment and how you're responding. And obviously in the metastatic space, everyone is so different in terms of where they have the metastases. You need individualized advice, and just get the right advice.
Sorry, thank you. And Lauren, there's a question here around visceral fat, and is it more exercise or is it more diet or is it a bit of everything?
Yeah, the body composition is a bit of everything. We absolutely, want to, like I mentioned when on that body composition slide, it's it's about trying to increase lean muscle mass as well as minimize fat to an acceptable level. So as far as how to address that, exercise plays a really important role, but also getting really good advice around nutrition is important, and those two things generally sing together.
I do like this one because there's so much of it, particularly around social media at the moment, that is infrared saunas for muscle recovery good.
I'm going to pass on that one.
It's like a very new fad, isn't it? That everyone thinks it's good for you.
And there always will be. And I'll just, when we talk about exercise as a treatment, and whether it's, in cancer population or for non-cancer, it's really safe. Exercise is a safe modality and it doesn't have side effects. The only side effect, sometimes that you would experience would be that, muscle soreness, usually, delayed a couple of days after you've done the exercise. It's sort of part and parcel when you are exercising and you haven't exercised before, or if you're exercising new muscle groups. So it's something that, if it is, too much or is, really uncomfortable, heat was mentioned before, hot packs, we will talk to patients about, keeping up hydration, sometimes a little bit of pain relief. But for most people, muscle soreness, after exercise is something that will just, naturally over a couple of days disappear.
Thank you so much, Lauren. And I always like to make sure that our consumers have the very last say and deliver us their wisest of wisdom and experiences. So Naama, I'm going to ask you to go first, and really what have you taken out of tonight, and what is a really important message that you might have told yourself or a younger self, or that you want to share with the network tonight?
I think something that Lauren touched on or mentioned is that when you have a cancer diagnosis, people tend to think that you can't do a lot, and they would encourage you to really go easy, and you're sick, you're all this, and I've really resisted. I felt really strongly that people were having really best interest, but I could walk and I could run, and I felt that I can do this, and it was such an important thing for me to keep doing everything I could as part of my routine. So even though your friends and family might feel that you need to rest and that they're doing the right thing for you, advocate for yourself in the same way that we encourage you to advocate with your treating team. And you should talk to your treating team, as Andrea said, and have them help you get a plan in terms of exercise. Also with your family and friends, and say, I really need to exercise. It is part of my recovery and part of my treatment, and make sure that they give you the time to do the exercise that you need. Think about it as medicine, as part of your treatment plan. It's holistic. It's not just chemotherapy or radiotherapy or surgery. Exercise is part of it. And once you factor it in, then the motivation is just the next hurdle, and it is just a hurdle that you can overcome. So that would be my advice to all of you here.
And Andrea?
Well, for me, I mean, picking up on what Naama said and what Lauren said, I think what the key thing for me was flicking my thinking to thinking this is an exercise prescription. This is something that is part of my holistic treatment. And it's not just about the drugs that are prescribed that are going to impact on how I feel and my survival or the risk of recurrence. It's exercise is really important, and there's a good evidence base around that. I think more generally, my advice would be find something that you enjoy doing and that is achievable. For me, it's finding a team sport that is sociable and relatively low cost, that has increased my network of friends, and I feel very supported with them. And that allows me to adapt how much I exercise depending on where I am in my disease trajectory. It gives me that flexibility. So yeah, I just say, think of it in positive terms and of all the benefits you can get out of it.
Thank you both so much. So powerful. And I wish that you could all see what's going on in the discussion, because you are very loved by the hundreds and hundreds of people who are watching tonight. And Lauren, people have found your presentation just so very practical and helpful. And just a reminder that we will be sending out some more information as a follow-up email to this around what exercises you can do in the home. And I know there's been lots of comments about home exercises and kind of knowing that actually doing things like hanging out the washing is helping your lymphedema, and just giving yourself a bit of a break and not having really high expectations. So thank you all so much. Before we go, I just want to remind people that there are so many resources available for people living with metastatic disease and early breast cancer. I hope you've received your April Beacon, which not only shares incredible stories from our network, but also the latest in research. If you haven't, call the helpline and they can register you for that. We're heading to Shepparton Wednesday, the 26th of June. So anyone in Shep, we'd love to see you there. There are some incredible podcasts, and I know they were spoken about in the discussion forum tonight by Dr. Charlotte Topman, who herself has had breast cancer but is a clinical psychologist. And I know Lauren really talked about that psychosocial impact of breast cancer diagnosis on you and the importance that exercise can play in that. There will be lots of links already in the discussion of different places you can go to our information hub, including some really fantastic webcasts on lymphedema, because I know that we've done some more webcasts where we really dive deep into the impact of lymphedema and provide some practical tips. And there's resources on exercise after surgery, in preparing for surgery, and a whole lot of other information around exercise. This is our New Look website. The information hub is what we've been talking about tonight. You can simply put exercise in there and all of our resources will come up. We do know that people are often surprised by just how much information BCNA has. So really encourage you to go onto the website and look for information that is right and relevant for you. It is always super important for you to take care of yourself, and there are lots of places to reach out for help. And we've talked about our helpline tonight, open Monday to Friday, 9 till 5, and the team will make sure that you don't find out about a service that was just around the corner when it's all too late. And of course, I know Andrea talked about the Cancer Council as well. If you are experiencing high levels of distress, then please reach out to Beyond Blue and Lifeline, who are all available 24/7. It has been so fantastic. We're slightly over time, but that's because the content is incredible. The discussions have been wonderful, and I hope I got through as many questions as I could. And I'm sorry to those people who I couldn't reach out for the questions. We will hopefully come back with the answers to many of those through the email that you'll receive. This recording will be available ongoing. It'll take us a couple of days to get that up and running, and then it'll be circulated to you, because I know there's been a lot of information shared tonight. So from everyone at BCNA, a very big thank you to our speakers, Andrea, Naama, and Lauren, and to everyone online, please stay safe and reach out for any help you might need.